The FDA is approving a new way to fight COVID. An experimental antibody cocktail will be made available for hundreds of thousands of high-risk patients.
Regeneron's antibody cocktail is the same one President Trump received when he contracted the virus.
WGN's Brona Tomoti has been speaking with a local doctor involved in clinical trials of this treatment. Brona, what have you found out?
That's right. People probably know this as Regeneron. Regeneron is actually the name of the company, and the treatment itself is REGEN-COV2. It's an antibody cocktail that has now been authorized for patients recently diagnosed with COVID-19. However, other criteria needs to be met too before this would be an option for you at home. Ideal candidates are those who have mild to moderate cases but are high risk. Things like age, weight, underlying health conditions will all be factors. Basically, this will be available to those who are at risk of developing a severe case of the virus. And the hope, of course, is this will help people recover without ending up in hospital. Now, the Cook County Health Department has been taking part in a prevention trial of Regeneron since August. One of the doctors involved in this trial is Dr. Sybil Hosek, and we spoke with her earlier this afternoon about why people might get this treatment when a vaccine might be on the horizon.
Monoclonal antibodies for treatment and prevention are going to be supplemental to vaccines. So first of all, we know that probably not everybody is going to get a vaccine. Just based on what we hear, some people don't want to do vaccines. We would encourage you to, but they don't want to. Those people may still be vulnerable to COVID, and so having the option to have antibodies if they get infected would be really important. There's also people who don't respond well to vaccines in terms of they don't really develop a really strong immune response on their own. And so for those people, this would also be an option. It would help sort of jumpstart their immune system to fight off COVID if they were infected with it.
Now, we're told initially 300,000 doses of this will be made available in the US by the end of the year. How exactly it will be distributed around the country remains to be seen. Again, it's not something that will be available to everyone, but it might just be an option for those who can avail of it.
Good to hear. Thank you.